You need to see this before considering a knee replacement. Relieving knee pain as a plus-sized woman is hard, but I finally found the answer. Before I discovered what I am about to share with you, I tried everything under the sun to get relief from my arthritic knees. Knee sleeves and braces were either too tight or just rolled down my leg. Injections and physiotherapy were expensive and never gave me any real relief. It was looking like my only option was to go ahead with a knee replacement surgery, until I met world-famous knee pain expert, Dr. James Barkley, and he shared with me a simple way to heal your knees at home. And no, it doesn't involve losing weight, painful stretching routines, and it definitely doesn't involve getting invasive surgery. He told me all I needed was 15 minutes of my day, and I could put an end to my stiff, achy, and swollen knees. After just 12 days of doing what Dr. Barkley showed me, I was almost completely pain-free and back to doing all the things I once loved but had to give up due to lack of mobility and grinding bone-on-bone knees. And now I am going to share this information with you too, so keep watching, because what you're about to learn is the key to stopping your unbearable knee pain. But first, you need to know what's really going on that's causing your knees to be in so much pain.
You're experiencing something called cartilage thinning. It's a degenerative disease that affects your knee joint. This means that the cartilage cushioning your knee joint is wearing down, which leads to grinding bone-on-bone knee pain, severe osteoarthritis, and instability in your knee. Simple everyday activities like driving, going up and down stairs, getting out of a chair, and sleeping become incredibly uncomfortable. Cartilage thinning not only causes physical discomfort, but also steals your freedom and independence. Your life quickly becomes a nightmare. The constant stabbing knee pain and swelling turn family gatherings into a spectator sport where you watch life from the sidelines, nursing your aching knees, leaving you feeling trapped in your own body, watching the world pass by, a prisoner of pain in what should be your most active years. The problem with cartilage thinning is that your knee's cartilage wears away as you age, and the aches and mental torment will never go away.
Left untreated, condition can become much worse.
Imagine waking up each morning, not knowing which part of your body will betray you next, getting closer to a life confined to a wheelchair or facing the surgeon's knife. The worst part? Your knees need movement to stimulate blood circulation, which aids in healing, reducing inflammation, and eliminating pain. But we all know that when we have knee pain, the last thing we want to do is move, straining our hurting knee.
So that's the bad news. Now the good news. It's reversible.
Keep watching, because in the next 37 seconds, I am going to tell you exactly how. It doesn't involve any crazy pills or stretching routines, and you won't require surgery. In fact, you won't even have to leave the house. You can do this every day for just 15 minutes from the comfort of your own home. And within a matter of weeks, you'll be climbing stairs again with ease.
You might be surprised to learn that what's causing your knee pain is a hidden problem that no industry expert wants to discuss. Fact is, this is exactly why your knee pain can't be fixed with knee cream, sleep, physical therapy, or even an injection. The knives and needles of a top surgeon won't even help.
That's because any solution is doomed to fail unless it rebuilds the cartilage in your knees. Cartilage, a rubbery tissue, cushions your joints for smooth, pain-free movement, but that's only half the score.
But here comes the kicker. 85% of your knee's cartilage comprises connective tissue called protein collagen, the glue that holds your whole body together. You have too little collagen, it eats away at your knee joint's cartilage, further depleting your dangerously low levels, creating bone-on-bone knee pain, swelling, and arthritis.
On the other hand, increasing collagen production helps rebuild the cartilage in your knees and reverses your knee pain symptoms. Now, I know this might sound confusing, don't worry. Just think of it like this. No collagen means no cartilage, which means bone-on-bone knee pain and osteoarthritis. So that is no good. If you want healthy, flexible, and stable knees that will allow you to return to everything you love, you need to stimulate the production of collagen in your knee area rapidly. New collagen acts like a reset button, rebuilding knee cartilage in record time. It will allow your knee cartilage to rebuild and cushion your knee joint, ultimately eliminating that grinding bone-on-bone knee pain, making you feel decades younger and much more energetic.
Now you're probably wondering, who is this guy telling me about my knee pain? Well, my name is Dr. James Barkley, and I'm an orthopedic surgeon with over 20 years of experience treating bone-on-bone knee pain and osteoarthritis. I had already digested the latest medical journals, scientific studies, and trends showing that cartilage thinning in the knee joints that most Americans over 45 experience is way more severe than people realize. And the reason I'm qualified to talk to you today is, unlike your primary care doctor who is a generalist, treats pretty much any and all illnesses and injuries, My specialty is in one thing, and that one thing is bone-on-bone knees. This has led me to becoming an expert at that one thing. And while I might not be the best person to come to if you have the flu,
I am the best if it's anything to do with knee pain because all my energy, all my focus, and all my research and seminars, everything I have going on is related to osteoarthritis and bone-on-bone knee pain. Since the pandemic here at Rejuva-Knee, we've studied over 1,100 of my clinical patients, all suffering from severe stages of osteoarthritis and bone knee pain. Some of them couldn't even walk in, and many of them were using crutches. Well, what we found was a shock. So we've taken all that specific information and we asked ourselves this very important question. If the cartilage is like the shock absorbers for our knee joints, and it's 85% made up of protein collagen, what happens if we rapidly stimulate collagen production?
can we rebuild the knee cartilage? And the answer is profoundly yes. There's clear evidence that increased collagen production increases knee cartilage. At that point, we knew we were onto something. So the next logical question was, how do we stimulate collagen production?
According to our data and research, I concluded after many conversations with other industry specialists, there are 3 things that are clinically proven to target the root cause of your osteoarthritis and eliminate pain. However, there is a catch. All 3 of them must be used simultaneously in combination.
First on the list is heat therapy. It loosens the muscles around and inside the knee. It stimulates blood flow. This allows more blood oxygen and nutrients to deliver to the injured tissue. Better blood circulation results in cartilage recovery and healing. Massage therapy has been with us for thousands of years. How obvious, right? Nothing can beat the basics. The trick again is to massage the knee in the right area in order to pressure the right point right below your patella, or as we like to call it, the kneecap. So when done right, massage therapy relaxes your tight muscles and tissue. Your knee pain is released with a feeling of bliss and relief.
And finally, targeted compression stabilizes the joint, reduces inflammation, and prevents the knee from shifting, allowing collagen production to be amplified due to the decrease in inflammation. Collagen makes up 85% of your knee's cartilage. So by increasing collagen production, we can reverse the damage to the cartilage in your knees. At that point, we knew we wanted to develop a solution that targets the root cause of knee pain and osteoarthritis. It must have all these 3 technologies. After months, we finally developed a solution targeting the root cause of knee osteoarthritis pain, and it also reverses the symptoms of your cartilage thinning. It's called Rejuva-Knee, and it got FDA approved at the end of 2022. Unlike other products that only provide temporary relief for knee pain and osteoarthritis, this revolutionary device uses what we like to call the triple method healing approach. Your knee pain is replaced with feelings of bliss and relief, so you can get back to doing all the things that you love to do pain-free. Not to mention the real benefits of returning to living your best life happily and fulfilled. This means that within a few weeks, the cartilage in your knees could repair and rebuild, eliminating the pain, stiffness, and swelling associated with osteoarthritis, allowing you to get back to the things that you love. Without the constant knee pain and stiffness trapping you in your own body, you can be pain and worry-free. You'll feel years younger waking up every day knowing that the constant knee pain and swelling are things of the past. This breakthrough device can reverse cartilage thinning and give you the best years of your life back. That's not all. Rejuva-Knee helps improve blood circulation and reduces inflammation, further reducing the symptoms of osteoarthritis and improving your overall knee's health. Within 1 or 2 weeks of use, you'll start to feel significantly more energetic and the pain will disappear.
And the best part? It's so simple to use. It's as easy as 1, 2, 3. First, no annoying cords. You just charge it with the cable that comes in the box with your order.
Second, you slip Rejuva-Knee onto your leg and enjoy the soothing effects of heat and massage therapy. Thirdly, you experience what was stabbing knee pain and extreme discomfort transform into, well, nothing. The pain will fade and your knee will loosen up. The clicking and grinding will finally disappear.
So, as you can see, Rejuva-Knee is a game changer for anyone suffering from knee pain. With thousands of 5-star reviews and a 90-day money-back guarantee, what are you waiting for? You now have 2 choices. The first choice is to carry on about your day and forget you ever saw this presentation, each day becoming more difficult with increased pain and decreased mobility, upping the dose of painkillers to mask your agony, until one day the damage truly is irreversible. The second choice is to take action today and finally eliminate your knee pain and reclaim your life. Rejuva-Knee is that key to restoring the vital protein your knee requires to rebuild cartilage, and when you get it today, they will even give you 50% off your first order. The clock is ticking, so make your choice today before time makes the choice for you and your cartilage is completely unrepairable.